Thanks so much for being with us today during National Nurses Week. My name is Megan Collier from Texas Tech University Health Sciences Center Marketing and Communications. Excited about today's chat because we are joined today by Dr. Pearl Merritt, the Regional Dean of the TTUHSC School of Nursing at the Abilene campus. Thanks so much for being with us today.
Thank you.
So before we get started, I kind of want to we'd like to hear about everybody's Texas Tech journey. How are you here with us, and what do you do specifically on campus?
Okay. Well, I am the Regional Dean for the Texas Tech Health Science Center School of Nursing. I'm also the Regional Director for the Laura Bush Institute. A lot of people don't know that, but I am married. I have one daughter, beautiful daughter, two beautiful granddaughters that are just so much fun. Lots of animals. I have lots of plants, as you can see behind me. I love plants and I'm outdoors all of the time. And I love working at Texas Tech. Dr. Alexia Green, she actually has been a friend and colleague of mine for years. And so I was fortunate when they started building the Texas Tech schools in Abilene. I was actually working in Dallas as a president of a healthcare company, and I called Dr. Green and I said, I would love to get back to Abilene, and I see that there is going to be a school of nursing. And she said, oh, you've got to apply. And of course I had to go through the process, and there were other applicants, but I just feel so fortunate to be back in Abilene with Texas Tech, and I feel like I have the best career and job in the entire world.
That is so wonderful. We love to hear that for sure. Well, let's talk about Abilene, how things are sort of going. You guys like us in Amarillo have seen sort of an uptick in COVID-19 cases, right? So what's kind of the mood and the atmosphere there?
You know, I think it may be picking up where it's a little bit lighter mood and happier mood. Our numbers are not good. They have greatly increased. And so I think because of that, people are still sheltering in place much longer. You hear across Texas, some people are getting out, going to restaurants, and places are slowly opening up. And some are in Abilene and some aren't. You know, I hear back and forth in the community. Some say, well, we want to keep our business closed a little longer. Others are saying, let's try to get back to normal. But I think things are picking up here. They're going to be better. Even though our numbers are on the rise, I think we're doing a lot more testing. So I attribute a lot of that to the testing that we are doing here. But people want to get back to work for sure.
What about the students there? How's the transition from in-person learning to all online learning going for the nursing students in Abilene?
You know, we were very fortunate that nursing, we have done online courses for a long time. And I even teach the master's program online. And so that really helped us, that we weren't just thrown into it all of a sudden. And so I think we feel really comfortable with that. We miss the face-to-face, we miss our students, but we stay connected. And thank God we have modern technology where we can stay connected. You know, can you imagine back 100 years ago when they had these pandemics and they couldn't stay connected? So that's a positive thing, that we can stay connected. I think our students are doing well. I've had several. We actually had a donor that gave money to our students. They said, your students are on the front line, they're nurses, we want to help them. And so they've all been writing me thank you notes that we're going to give to the foundation. They're all saying, we're glad we got into the healthcare field. This does not scare us. We can't wait till we graduate and we're there on the front line. Of course, we do have some students that is their job. They're already working in the hospital, and I've communicated with them and they're actually doing very well. I've never had any students say, why did I go into this? They're all saying, that's why I went into this, to make a difference in the world. And speaking of Nurses Week, as you probably know, nursing is the #1 trusted profession in the nation. And because of all of the publicity that we're getting, I think you see the advertisement, nurses are heroic, nurses are on the front line. And so it certainly has brought a lot more attention to the nursing field in a positive way. I have never seen any student or anyone be negative about why they went into nursing. They're not afraid of this. They're ready to fight it.
I think that is interesting. I mean, all healthcare workers, go into this industry because they have big hearts and they want to help. But you do certainly feel that with nurses in particular, especially, if you're a patient or you're a family member of a patient, you really do appreciate a great nurse,
You do. And we've actually had some nurses that have graduated from school already. They have gone up north. I was talking to one of the students' dads. He's a vet, and he came out to take care of our dogs this week. And he was saying that both of his daughters graduated here from Tech. I said, how are they doing? And he said, one of my daughters, Michelle, went up north to New York and is helping out and being a traveling nurse and wanted to be right in the middle of that. And there are several of our graduates that are there and on the front line up north, New York City and other places that are totally inundated. And so, we're really, really proud of the fact that our nurses care. They want to take care of people and they're not afraid. They know that's why they went to nursing school. And they all say we're very prepared to do this.
That is so wonderful. And I'm sure that you've heard some really inspiring stories, some harrowing stories from them as well, right?
Yes, absolutely. It is not easy. I don't mean to paint a pretty picture because it's tough. And on the news this morning, I was watching a nurse being interviewed, and she was talking about staying with a patient dying, and she was, or he, but it was a she, was the only person in the room with the people that died, and the families could not be there. And she was talking about how important it was to help that person as they're ending their life. And she's the only one there to comfort them and help see them through it when their family can't be there. So, it's rewarding to know that there are people like that are willing to put themselves out there and go through that stress. And it's hard on their mental health, but that's what they're trying to do.
Really, really remarkable people for sure. And I wonder, in a time like this, when you see so much good, coming from nurses, I wonder, is there an increased interest in nursing programs, across the country, really, so they can, make a difference on the front lines and in this fight? Have you seen sort of an increased interest?
I absolutely have. And a lot of, we have a second degree program and people that already have a degree in another field, and then they come to school to get their bachelor's, and it's 1 year. And I've had people tell me, I'm interested in that second degree program. After seeing what the nurses are doing, I want to be a part of that. And they hear how rewarding it is. It's hard, but it's rewarding. But we are definitely seeing interest in this as a career. So we're thankful that it's bringing out a lot of good in a lot of people that want to do more. They want to help.
Can you talk more about the program and what that looks like for students out there, prospective students who might be interested?
Yes, I actually want to talk about the fact too, we have a partnership with Cisco College. We work closely with Cisco College. So they actually have an LVN program and then the LVN to RN program. So they get an associate degree there. But then we have an articulation agreement where they can come into Texas Tech for the RN to BSN program. And that is 2 semesters. And so they are really, that's really increased our numbers at Texas Tech. And it's actually brought more nurses into the field, into Cisco College, because they know they have that assurance after they graduate from Cisco, they can automatically go into Texas Tech. And then at Texas Tech, we have the bachelor's program. And then we also have the second degree program. So the bachelor's is 18-month program. They come in, they don't have summers off. They go straight through every semester and they finish up. And then our second degree, as I stated earlier, they have a degree and they come into our program and it's 1 year. But we also have, we work closely with the DNP program, the master's program, the nurse practitioner. I'm really proud of the psychiatric nurse practitioner, the new program. And we have people, students here in Abilene that are enrolled in that psych nursing program. As we know, there is such a shortage of psychiatrists and we need more psych nurse practitioners. So that's a wonderful program. I also want to mention, when I talk about the programs and our wonderful nurses that we have a clinic across the street from us on Pine Street. And we actually have some nurses. It's a nurse-run clinic. And one nurse in particular is a Texas Tech graduate. I actually had the privilege of teaching him in the master's program. And he is a nurse practitioner at our clinic. And during all of this time, the health department had to close down because a lot of the people had the virus. The women's clinic had to close for a short period of time, but our clinic was able to stay open for the underserved population. And our nurses there, I'm so proud of all of them because they just kept seeing patients. They got very creative in how they would see patients. They would go outside rather than the people coming in, they would screen them. I'm just really proud of our clinic also. But Abilene just has a wonderful nursing program, the clinic. We also have partnerships with School of Pharmacy and Public Health also. We work closely with them. So, you know, we just have a wonderful community and wonderful school here. I'm sorry, I went a little overboard, but
No.
we love Texas Tech and Abilene.
Well, we're so glad to hear about it. Thank you so much for chatting with us today about nursing and Abilene and your plans. And so now it's time for our lightning round. Are you ready?
I'm ready.
Okay, the first question is sort of challenging sometimes, I'll be honest. Crunchy or smooth?
I am going to say equal because I love food. I like crunchy and I love smooth. So I'm going to say equal.
Well, that is a first time answer. We like that. Okay, sometimes you're feeling a little crazy. Sometimes you want things a little smooth, right? What's your favorite ice cream flavor?
I love mint chocolate chip. That is delicious. I'm obsessed with that. So
I like that. Okay, now this can be a bit of a controversial question. Pineapple on your pizza or absolutely not?
I love pineapple on my pizza. Yes, for sure.
You know, there are those out there who are very much against this, but there are those that really support the pineapple on the pizza. It's a very polarizing topic.
For sure. I love it.
Okay. Now then, we usually ask, what's the first concert you ever went to? But today I want to ask, what's one of the most recent concerts that you've gone to that you thought was absolutely awesome?
Okay. So I'm going to say it is the Florida Georgia Line and Morgan Wallow because we have my two beautiful granddaughters that are age 14 and 16. And they begged me to take them places, and we went to Dallas to the concert and had a blast. And I loved it. I'm hooked now.
Well, good. How fun. How fun. I love that. Okay, now last question for you today. If you were in a movie or they were telling the story of your life in a movie, what famous movie star would play you?
You know, I think it would be probably Goldie Hawn. And the reason I say that, I did think, you know, as you said that, I'm thinking, I do like Meryl Streep in some movies, but she's been pretty wicked in some movies that she could be. And I'm thinking, I don't. Yeah.
I was thinking Meryl Streep initially was my first thought for you, but Goldie Hawn is an excellent number 2 and maybe a better number 1 in my opinion.
Goldie likes to have fun. I love to have fun. And like I say, it was going to be Meryl Streep, but then I thought, she's mean at times. I don't want her to play me. She's got that reputation. Goldie.
I love that. Well, I want to go to a Florida Georgia Line concert with you someday. You are just more fun, and we're so glad to have gotten to talk to you today. We appreciate your time. We appreciate all of the work that you do there in Abilene.
Thank you so much, Megan. I really appreciate you and getting to know you, and you're fabulous. Thank you.
Okay.